about 7 more speakers. If there is anyone else who wishes to speak, please see Zeke Furlong back and over the side, and he will get your name up here. Thank you.
Good morning. Thank you, Senator Hatchett, senators and representatives, for holding this forum, and thanks to all the people in the room here to contribute to Iowa healthcare. I'm representing the Iowa Association of Rural Health Clinics, 140 rural health clinics spread throughout the state of Iowa. It was created by Iowa Senator Dick Clark, matter of fact, 1977. I'm a PA that staffs one of the rural health clinics in Redfield, Iowa, a town of 835. One of our concerns is something that's been addressed previously by the Medical Society and by Des Moines University, and that is the primary care loan forgiveness. We would just ask one thing. We're supportive of that, certainly, because we want access to care for people in rural Iowa and throughout the state, but we're particularly interested in making sure it's all primary care providers. That would include nurse practitioners and PAs as well as physicians, because physicians are more likely to locate and stay in rural Iowa if there's PAs or nurse practitioners to share the burden. And there are many nurse practitioners and PAs located throughout rural Iowa. Every one of the surrounding towns, my small town, has a nurse practitioner or a PA in there. Some don't have physicians, but they have a nurse practitioner or a PA. The second thing is I want to thank the legislature for funding the safety net grants program. That's been very helpful. Helped us in our clinic do some innovative work as far as for diabetic care, and also helped us with a smoking cessation program. Those things are very helpful. And then the last thing I'd like to mention is that when it comes to Medicaid and Medicaid expansion, we're certainly in favor of having more health care accessible to all Iowans, and we're certainly interested in Medicaid expansion. But we would say that there's a problem when it comes to Medicaid recognition of physician assistants. The Medicaid program is proposing to recognize physician assistants for referring and ordering, but it really needs to be done for all physician assistant services, which include diagnosis, treatment, assisting in surgery, doing pre-authorizations, many other tasks. So let's not do it halfway. Let's do the whole program. Thanks very much for your attention.
Thank you, Ed. Jeremy Nelson, to be followed by Danielle Oswald.
Thank you, Senators, for hosting this, and thank you for your commitment and ongoing hard work to improving health care for Iowans. My name is Jeremy Nelson. I'm the immediate past president of Iowa PA Society. We above all believe in quality and accessible health care for patients, and our legislative priorities this year are the elimination of barriers to medical care, the implementation of health care changes to include the most efficient combination of all health care providers, and full medical recognition of PAs as medical care providers. Due to new federal laws requiring transparency and accountability of all medical providers, Iowa Medicaid needs clear authority to fully recognize Iowa PAs as medical providers of all physician type of medical services. Did I? Awesome. Okay. Medicaid rules currently recognize PAs only as auxiliary personnel under the physician's Medicaid number. There are 1,000 licensed physician assistants providing essential medical care to Medicaid patients. This includes rural and underserved areas. Recognition of PAs will be especially important as more and more patients receive care coverage. PA enrollment needs to include all types, as Ed said. I don't need to repeat that. Last, recognition would not change the PA's scope of practice or the requirement that PAs practice with physician oversight in a physician-directed team. Now, for our healthcare system to operate efficiently, all medical care providers, including PAs, need to be fully integrated into any new models of care, such as the ACO, electronic health records, workforce initiatives, and telemedicine. Barriers to care that we're concerned about this year that we think should be eliminated our lack of insurance coverage for PAs providing psychiatric care, or payment at out-of-network rates, which substantially increase the cost to patients and decrease access in the face of severe mental health shortages in Iowa. So should be eliminated the lack of statutory authority for PAs and nurse practitioners to give information to judges about patients needing hospitalizations for being a danger to themselves or others. This is especially important as a significant amount of PAs and NPs practice in our rural communities. Thank you so much for your time.